On the occasion of World Hepatitis Day, which is observed on July the 28th every year, I would like to tell you some things about viral hepatitis. Now, viral hepatitis means viral infection of the liver. Now, there are different types of viruses which infect the liver. They are called as hepatotropic viruses. We have got viruses called hepatitis A, B, C, D, E and G viruses which affect the liver. Now, once these viruses infect the liver, they reach the liver, they cause inflammation of the liver cells, and this leads to different symptoms. The most predominant symptom is jaundice. Now, these different types of viruses are spread from one person to another in different ways. They cause different types of jaundice. In some, they cause only a jaundice of a short duration, which is called as acute hepatitis. In some, they last in the body for a longer time, leading to what is called as chronic hepatitis. I would like to tell you in short about each of these viruses and what they would cause in an individual patient when they infect a patient. Now, the first of these viruses is called as hepatitis A virus. Now, this virus is also previously, it causes what is previously called as infectious hepatitis. That is, it is spread from one person to another by what is called as the fecal-oral route. It spreads by infected food or infected water. Now, this hepatitis A virus is commonly seen in the age group of in the first or second decades of life, that is in between about 5 to 14 years of age. It commonly spreads when people drink infected food or infected water, that is called as a fecal-oral transmission. This hepatitis A virus is known to cause acute hepatitis. That means it causes hepatitis of a short duration. It does not cause chronic hepatitis like other viruses which last beyond 6 months. Now, when somebody gets infected with hepatitis A virus, the virus goes into the liver. In the initial few days after infection, the patient is asymptomatic. But after some time, the patient starts developing symptoms of prodromal symptoms like loss of appetite, fever, malaise, body ache, vomiting, nausea, etc. After a few days, the patient starts developing jaundice in the form of yellowish discoloration of the eyes, yellowish discoloration of the sclera, and so on. Now, this jaundice lasts for a period of about 6 to 8 weeks. During this period, the patient has got symptoms of loss of appetite. He requires some medical help and supportive treatment. For a period of 6 to 8 weeks, the patient gradually recovers. There is no chronic hepatitis, and the patient completely recovers at the end of 6 to 8 weeks. There is no specific treatment that is there for hepatitis A virus. We only support the patient during the time of the illness. A very unfortunate few patients land up with what is called as a cholestatic phase of hepatitis virus infection, wherein they have got severe jaundice. The jaundice is associated with severe itching, which lasts for about maximum 12 weeks. Very rarely, this virus can be fatal to the patient. Now, as far as prevention of this virus infection is concerned, as far as we provide good food and good clean water to the patients or to the community, we can prevent the spread of hepatitis A virus from one person to another. Because of good sanitary measures and development in developed countries nowadays, the incidence of hepatitis A virus in the developed world is very less. But in our country, there is still evidence of that hepatitis A virus is commonly seen, especially in the rural areas and in patients in whom there is no proper water supply, or whenever the patients have got infected, or people are eating contaminated food, especially food at the roadside, etc. There are vaccinations available for hepatitis A virus which are given commonly to people who are at the newborn age or people who are traveling to endemic areas of hepatitis A virus infection. Otherwise, routine recommendation by hepatitis A virus is not recommended in our country as of now. The second important virus which I would like to tell you about is hepatitis B virus. Now, this hepatitis B virus spreads from one person to another by infected blood and blood products. It is one of the most important causes of liver disease worldwide, and it is supposed to be causing about 1 million deaths per year worldwide. Now, hepatitis B virus spreads from one person to another in the following ways. It can spread when infected blood spreads from one person to another. It can spread when there is a pregnant lady who has got hepatitis B virus. She can give it to her child during delivery. It can spread sexually from a husband to the wife. It can spread by using infected blood and blood products. It can spread by things by procedures wherein infected instruments are used, like a tooth extraction or tattooing, etc. These are the commonest modes of spread of hepatitis B virus from one person to another. Once the hepatitis B virus enters the bloodstream of a given patient, it can cause many things. Hepatitis B virus is known to cause the entire spectrum of liver disease. It can cause simple jaundice like acute hepatitis. It can cause chronic jaundice, chronic hepatitis lasting for more than 6 months. It can damage the full liver called as cirrhosis or end-stage liver disease. It can also cause liver cancer. And that is why it is very important for us to prevent the transmission of hepatitis B virus from one person to another. Now, once a hepatitis B virus enters a patient's blood, in about 30% of patients it causes acute hepatitis called as jaundice. The patient develops a prodromal symptoms. He develops nausea, vomiting, joint pains, fever and rash, and after a few weeks he starts developing jaundice. If the patient is fortunate enough, he would develop jaundice for a few days or a few weeks and recover from the jaundice in a few days. This type of patient would recover without any support, without any specific treatment, except for any supportive treatment that we give for any other patient of jaundice. In a very unfortunate percentage of people, say about 1% or so, they develop what is called as fulminant hepatic failure, wherein the liver fails and the patient sometimes loses life because of acute fulminant hepatic failure because of hepatitis B virus infection. In about 30% of patients who are infected with hepatitis B virus, they land up in what is called as chronic hepatitis. That means the virus continues to stay in the body for more than 6 months. It is in this group of patients that is wherein we do a lot of investigations to find out whether the virus in a particular group of patients is active or inactive. These are investigations like blood tests, like the DNA levels. We do the test to see whether the virus is replicating, multiplying in the body, to see whether the virus is troubling the liver, it is harming the structure of the liver, and over a period of time we follow up these patients. In those group of patients in whom the virus is active, in whom it is troubling the liver, we have got specific medications to try to control the process of destruction of the liver by antiviral oral drugs. We have got injections like interferon injection, which can stop the process of destruction of the liver by the hepatitis B virus, and we try to stall the progression of disease. There are different types of drugs available for hepatitis B virus infection now. They are called as lamivudine, entacapid, tenofovir. These are drugs which we choose depending upon the patient's condition, the patient's age, the patient's viral load, and many other, and depending upon the liver function of the patient. So these are drugs which have been used, which are nowadays routinely used to prevent or to treat patients with chronic hepatitis B virus infection. Lastly, the most important part about hepatitis B virus is that it is preventable. We have got good hepatitis B virus vaccines which are available, which can prevent the transmission of hepatitis B virus to any one person. These vaccines are available now, and we have got we usually have these vaccinations which have been given, which can be given at 0, 1, and 6 months of time, and after about, when a patient has got about 3 doses of these vaccines, he can be protected for more than 95% of the times. He can be protected from getting this virus by transmission through blood and blood products. The next virus is hepatitis C virus. Now, this hepatitis C virus is very much like the hepatitis B virus, which as far as the spread of the virus is concerned, it spreads very much like the hepatitis B virus by blood-to-blood transmission, by infected blood and blood products. The only important difference is that, unlike hepatitis B virus, the hepatitis C virus very rarely causes acute hepatitis. Most of the patients who get infected with hepatitis C virus land up with what is called as chronic hepatitis. Now, these patients usually would develop the entire spectrum of chronic hepatitis. They would develop chronic hepatitis, develop cirrhosis or end-stage liver disease, and then going on to develop hepatocellular carcinoma or liver cancer. Now, hepatitis C virus is said to be more infective than hepatitis B virus as far as the infectivity of the blood is concerned. Once somebody gets hepatitis C virus infection, he would land up with chronic hepatitis. The virus would stay in the liver for many years, and after about 10 to 15 years of infection, the patient will land up with end-stage liver disease and liver failure. The most unfortunate part about hepatitis C virus is that there is no vaccine available for the prevention of this virus for transmitting from one person to another, and that is why we have to take care as far as our transmission of this virus is concerned by using good or safe blood products when we use them from one person to another. There is no vaccine available as of now for prevention of hepatitis C virus in the community. Coming to hepatitis D virus. Now, this hepatitis D virus is a virus which cannot survive on its own in the body. It is a co-infection with the hepatitis B virus. That means patients who are already infected with hepatitis B virus can get super infected with this hepatitis D virus. The important part about this infection is that when somebody gets super infection with hepatitis D virus, the type of hepatitis they develop is very severe, and many times it can be fatal. There is no specific treatment available for hepatitis D virus other than interferon injections. The incidence of hepatitis B virus in our country is very low, and that is why we are not much worried about this type of infection in our country as of now. The last virus which I will tell you is about hepatitis E virus. Now this hepatitis E virus is very much similar to the hepatitis A virus. It is an RNA virus. It spreads from one person to another by infected food or water. It causes jaundice which is very similar to the hepatitis A virus. That means when somebody gets or somebody consumes contaminated water or food, the virus goes into the liver, starts causing inflammation of the liver cells, and the patient lands up with a prodrome, a few weeks of prodrome, and a few days of prodrome. In fact, when it develops nausea, vomiting, low-grade fever, joint pains, malaise, etc. And then it develops the classical jaundice when the patient turns, when he has yellow eyes, yellow vision for a few days, and the patient gradually recovers. Now this hepatitis E virus, very much similar to hepatitis A virus, can cause sporadic jaundice in the community. In our country, it has been seen that this hepatitis E virus has caused epidemics of jaundice in different parts of the country because of contaminated common sources of water in different parts of the country. Nowadays, when somebody comes to us with jaundice in the OPD, the most commonest cause of jaundice in our community nowadays is said to be because of hepatitis E virus. Fortunately, the hepatitis E virus is a mild infection, and most of the patients with jaundice recover within a few weeks after infection. It is only in pregnant women, when hepatitis E infects the pregnant women, it is said that for some unknown reason, the mortality in these pregnant women is very high, said to rise ranging from about 10 to 20% of patients of hepatitis E virus with pregnancy have a severe form of infection. Otherwise, in the general community as such, hepatitis E virus is got a mild disease, and patients with hepatitis E virus develop jaundice for a few days, and after a few weeks they recover from the jaundice totally. Hepatitis E virus does not cause chronic hepatitis, and that way it is a safe virus. As of now, there are no vaccines available for prevention of hepatitis E virus infection.